Hi everybody, my name is Lauren Shields and I am a SLU 2025 OT graduate. I am currently an occupational therapy fellow at Tampa General Hospital down in Tampa, Florida. But I wanted to back up a little bit and tell you a little bit about my fieldwork. I did rotations at inpatient rehab at Encompass Van Mater in Rockford, Illinois. And then I did a rotation in early intervention home health, which is kids ages 0 to 3, through PT in Chicago and downtown Chicago. But both of those rotations were absolutely amazing. I was somebody that did not know whether or not I wanted to go into pediatrics or adults, so I opted to do one of each, and honestly, it was the best decision. Just because they're so different, and you really don't know how things are going to shake out and if you're really going to like all the nuances until you're actually doing it. So if you are curious, I definitely recommend doing one of each. But something that I found to be a little bit tricky about fieldwork was adjusting from the classroom mentality to being more of a treatment mentality, being like more of the OT practice side of things. Any therapist will tell you that the most learning that occurs is on the job. School teaches you everything that you can, but a lot of those skills really come from working on using those on the job. Especially for me, everything is subject to change. And no two diagnoses present the same, so you really have to be able to be flexible and think quick on your feet, which is something that I found to be really important. But something that I've also found to really help with success in fieldwork is being flexible and open to feedback. Just because all of your CIs have tips and tricks from everything that they've learned, and they are just trying to impart their wisdom on you and help make your life easier and help facilitate your learning. So being open to trying them and kind of sorting things out for your own is really helpful. Not everything works for everybody, which is okay, and your CIs definitely know that. But just being open to try is always a great thing. Like something that I learned is that a lot of the times we're kind of told that gait belts go around the middle, but for a lot of like the more complex patients, they might have some like tubes or drains or something around their middle. So putting it around their hips is really good, and it gives you a better leverage because this is where your center of gravity is, especially when you're sitting. So that's something I learned that I never would have known otherwise. Or like in pediatrics, don't phrase things as a question if things aren't a question. So instead of saying like, do you want to do this? Say this is what we're going to do, and not give no as an option just because, how are you supposed to continue if they say no? Because you want to still respect what they're telling you. But those are just two things that I learned on fieldwork that I thought were really important. And yeah, so next I want to talk a little bit about the MBCOT, so the thing that we've all been waiting for, right? My schedule and timeline was a little bit different for studying just because I had to have my exam results by mid-July, and then I had to have my certification by the 1st of August. So I kind of did things at a different pace. I studied during fieldwork, which not everybody does, which is fine, but something that I found, I studied for about 4 weeks part-time on the weekends during fieldwork, and then 2 weeks full-time, pretty much like 10 hours a day, until I took my test. I was a little unwell, but you gotta do what you gotta do. Something that I did to kind of hold myself accountable is I plugged in, like, I'm studying for 4 weeks part-time, 2 weeks full-time into ChatGPT and had them generate a study schedule, which was great. And then, so I plugged in like my timeline, how many weeks I was spending part-time, how many weeks I was spending full-time, as well as the study resources that I was using. So, and they kind of spit out a schedule, and I really kind of took that as a baseline and adjusted as I went to see, okay, I need a little bit more time here and a little less time here, and kind of even things out that way as I went. Speaking of that, I found the MBCOT practice tests to be really helpful. I took the first one as a baseline just to see where I was at before I started studying, just to see, okay, these are my areas of improvement, here's where I'm good, here's how I'm going to adjust my study schedule. So after I did that, I really liked to use the AOTA PDFs and my notes from class to kind of fill in all that information. And then I kind of scheduled out times to take MBCOT practice exams, and I really tried to simulate the exam conditions as much as I can. So giving myself the full 4 hours, having it in a quiet room, all of that good stuff. So I really tried to simulate the test environment the best that I can. And then after I would take the test, I would kind of see my score and then retailor my study program. and then build in a few days where you kind of review things that you need to go over specifically instead of having like, okay, today is cardiac day, you know. Other things I found helpful were some more passive study tools that I kind of used like as I was driving on my commute, or if I was, doing like a little walk or something while I worked out. I found OT Exam Prepper podcast, the OT Dude podcast, and OT Miri videos to be really helpful. OT Exam Prepper is great if you love mnemonics. He does mnemonics for all sorts of like the more memorization based stuff like Allen cognitive levels or Rancho levels, which I thought were great. And then he also has PDFs that you can print out that are more visual with all of those mnemonics on it. OT Miri, I'm sure as you've heard, is absolutely lovely. She does a really good overview of a lot of more complex stuff. Like she'll do a broader overview of pediatric developmental milestones or like burns and here's how you treat them. And so does the OT dude. He gets more in the weeds. OT Miri is more a little bit generalist and broad. But both of those were really great for just listening and absorbing information, more as like a passive form of studying. But that being said, I'd like to talk a little bit more about my job. I am so obsessed with my job. I could talk about it for hours, but I'm just going to give you a quick little snippet. And if you are at all interested in an OT fellowship or in acute or critical care, Dr. Adam has my contact info. Please call me. I could talk about this forever. But my job search was a little bit different. I discovered OT and critical care the winter before I went on field work. I was a rehab tech at a hospital in my hometown, and that winter they were doing a push to get therapy more present in ICUs. So I had the opportunity to really assist those therapists in getting a lot more of the complex patients and people in the ICU mobilized sooner, which I thought was just absolutely amazing. The therapists, they were great, and they were all really excited to help me learn, and that kind of sparked my passion for it, which was just amazing. But I did not have a fieldwork rotation in critical care or acute care in general, which is okay, which is why I thought, okay, I'm not going to have a lot of the clinical experience, so I'm going to look for programs in hospitals that have a little bit more mentorship or more vetted, solid, stable mentorship opportunities, which is how I kind of stumbled across fellowship and residency programs. In addition to the Tampa General Fellowship, I found a bunch through the Veterans Administration. They have fellowships and residency programs all over, but the VA fellowships focus a lot more on like specific pathologies. So they have like a neuro fellowship or a hand therapy fellowship or like a orthopedics fellowship. Something that I really liked in inpatient rehab was more of like the broad diversity of diagnoses. So you can kind of like you'll see like an orthopedic patient, and then next you'll see like a cardiac patient, next you'll see a neuro patient. So I kind of like the variety. So that's kind of what drew me initially to the Tampa General Acute and Critical Care Fellowship. Also, the Tampa General Fellowships really put the emphasis on ICUs and mentorship in the ICUs. But before I get into that, I completed 3 rounds of interviews in January and then once again in February, and then I took the job in May. Actually, on the day of graduation, I did my last interview, which is really exciting. But yeah, that's kind of how I discovered the Tampa General Fellowship. And fellowships for OT are a little bit more on the lesser known or like not as common side, which is really interesting to me, but that's a whole other conversation for a different day. But what I really liked is that it kind of bridges the gap between OT student and OT practitioner. So I will do rotations in all of the Tampa General ICUs. Tampa General is a level 1 trauma hospital. So we get all of the sickest of the sick people all over the southern region of the United States, which is something that's really cool. And I have the opportunity to work with a lot of really different patients. But I will do rotations in the cardiac ICUs, the transplant ICUs, surgical trauma, trauma ICUs, neuro ICUs, vascular ICUs, and then I'll also be present on all of the regular acute floors and step-down floors. Like for example, I'm on orthopedics right now, and I go on standard ortho floors, but I also see patients on the surgical trauma floors, which is really cool. But with each one of these rotations, I am paired specifically with a mentor that's kind of permanent on that floor to really walk me through all of the ins and outs of that floor. So they're gonna walk me through like this common lines, drains, and incisions I see on that floor, certain procedures I'll see on that floor. and really make sure that I'm feeling confident as a new grad to see these patients on my own, which is something that I really appreciate. So just, that extra mentorship to really make me feel confident. But addition to the one-on-one mentorship that I receive, I also am doing didactic coursework, so more classroom stuff. But that's like attending lectures. There's also a bunch of physical therapy residents and fellows that arrived around the same time, so we do a lot of our lectures together. So that's more of like giving us information about the floors. Like, here are common ways that they, open airways. So here's how they intubate. Here's what typical intubation looks like. Things like that. Or like wound care, we'll do kind of labs on wound care together, which is really fun. So there's the fellowship mentorship, there's the didactic coursework, and then there's also an opportunity for research. So each fellow and resident has a research project that they work on throughout the year. My topic is currently undecided, but I will follow up with you on that. And then at the end of our fellowship and residency, we present to the entire hospital-based rehab team. And then we also get the opportunity to present at AOTA and submit for a presentation at AOTA, which is really cool. So maybe you'll see me at AOTA, which would be really exciting. But in addition to the research project, I also get to shadow other specialties. So I'll get to go around with rec therapy and the therapy dogs, which I'm very excited about. I'll get to shadow and talk with nutrition and dietetics. I'll get to talk with a lot of the other residents and doctors and physicians that are on the floor. So Tampa General is a very big teaching hospital, and they're affiliated with the University of South Florida. So we get to do some like interdisciplinary resident and fellowship rounding together, which is really cool. And I'll also get to go into the OR and watch some surgeries. I'll also get to observe the ethics review committee. So those are the people that Tampa General is one of the biggest transplant hospitals in the country, and what the ethics review committee kind of does is say, okay, here are like the organs that we have, here's the transplant list, let's match up these organs with these people that need transplants, which is really cool. So I get to kind of see how those decisions get made, which is really awesome. But yeah, I could go on and on forever about this job. I've been working for about a month, and it's been the coolest opportunity. Something that I think is really special is that I do get all of these extra experiences, and I do get all this mentorship, because the transition from student to therapist can be really tricky. Imposter syndrome really is real, and it can really get to you, especially as somebody with less experience, like a new grad. But my mentors are truly my biggest support system and biggest cheerleaders. They are there for every question I have. They really walk me through, like, I'm doing a new EMR documentation system. Here are these patients that I've never seen somebody with like open abdominal cavities. What am I supposed to do with them? They're there for all of those questions and to really guide my practice. But then they also have a lot of faith in me. They're like, girl, you got a master's degree. You go use it. You know what you're doing. So it's really nice to have that support system that's available for all my questions, but also that has the faith in me to really practice on my own. So that's another really great thing about the fellowship, is that it kind of helps that adjustment. But I am the biggest advocate for this. I love this job. So if you have any questions at all about fellowship, residency, acute care, or like you're really interested in the critical care side of things, Dr. Adam has all my contact info. Please feel free to text me. I would love to chat. Email me, call me, FaceTime, whatever you want. So I wish you guys the best of luck, and good luck on fieldwork. Congratulations.